Let's now turn to health matters. The Nigerian Institute of Medical Research, as it says, it will be hosting researchers in the area of Helicobacter pylori, a bacteria that can cause an infection in the stomach or intestine. Also, the African Helicobacter and Microbiota Study Initiative will serve as an advisory body as Nigeria moves to reduce the prevalence rate of Helicobacter pylori. Sarah Yeko reports.
This is the official presentation of the African Helicobacter and Microbiota Study Initiative, a multidisciplinary group comprising of at least one representative from several African countries. One of the goals of this study group is to advance Helicobacter pylori research, determine the accurate prevalence, diagnosis, and treatment of H. pylori infection and associated complications in Africa. H. pylori is a gram-negative spiral bacterium usually found in the stomach. Since it is a neglected bacterial pathogen in need of attention in Africa, Director of Research at the Nigerian Institute of Medical Research and microbiologist has been working on the peculiarities of the infection in Nigeria while collaborating with European partners. Professor Stella Smith will be heading the research team.
What we've done so far, we've looked at the prevalence amongst people that are called dyspeptic. Those are people that belch regularly, that have heartburn, that have early satiety, that is, they always are filled up without taking much of it, and they have bloated tummy, so things like that. So for those people, we have tested H. pylori. So we cannot really say the community prevalence of H. pylori is this. So that's one of the gaps our group is going to fill in. We're going to go to the community for people that are healthy, apparently healthy individuals.
It has been reported that 50% of the world's population are infected with H. pylori. And in Africa, there are studies showing that we have an 80 to 90% prevalence rate.
Really important study groups in Europe and Africa and Asia, in South America, and we learned a lot from these groups. But what we need is more data from Africa, because here we have the highest prevalence, about 90%. That means 9 of 10 people are infected in Africa.
We are practicing now according to what's called evidence-based medicine. Evidence-based medicine lies on what we have from the data generated and the efficacy of the medications, for example, that we tested on people. So in Africa, to manage this bacterium, which is affecting around half of the population, we should have our own evidence. I mean, we should have tried our diagnostic tests in our population, we have tried medications in our population, and we know which one is effective in diagnosis and the treatment.
The study group will be reviewing trends in epidemiology and antimicrobial treatment and resistance of H. pylori in Africa.